is now starting. All attendees are in listen-only mode.
Hi, good afternoon, everyone. Today is June 26, and I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of DDA updates. And today we have several presenters. First, Bernie Simons, the Deputy Secretary for DDA. We have Shara Davidson, Russ, Program Manager for MMARS, Inc. Alan Sheehan, Program Director for Service Coordination. And as always, we have Patricia Sestoki, Director of Programs, Rhonda Workman, Director of Federal Programs, Valerie Roddy, Director of Fiscal and Operations. And I hope I got everyone. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There is one option for listening to the webinar, and that's by computer. There's a handout for this webinar, and you can find it in the handout section on the panel to your right. We are recording the webinar, and we'll post it on the DDA website. And questions can be typed in the question box in the webinar panel. And hopefully we will be able to get to those by the end of the presentation. So now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Thank you, Donna. Good afternoon to everybody, and thank you for attending our webcast here. Today's the 14th webcast. It's absolutely amazing that we've done 14. We started these on March 27th, and we've had great attendance to the point where we had to change our platform because people were not able to attend. Just as an update, next Friday we will not be doing a webcast because the 3rd is on Friday, which is the state holiday for people. And then after that, I think we're going to go to every 2 weeks instead of every Friday. And so we'll be doing that and taking a look at what that looks like. In the past few weeks, we've had, or last week actually, we had the East Shore and Central Region. So today I've asked Kathy Marshall and Onesta Duke to basically share their experiences and the experiences of the providers who participated recently in reopening strategies and discussion about what that would look like, what type of guidance, what's the new normal, etc. We had some providers talk about this a few weeks ago also, so I thought it'd behoove us to basically say, so, okay, that's okay from the provider who is doing some type of residential day, employment, etc. I think to round out the rest of our system, it's like, all right, so where's case management? Can we hear from them what their role? We all know that they're doing wellness checks, et cetera, et cetera. So I want to thank the staff from MMARS and Service Coordinating for being here and joining us today. So I want to talk a little bit about our priority being health and safety and wellness. Yesterday there was I had the opportunity to present to the Senate Budget and Tax Committee, and it was basically the Health and Human Services Subcommittee, and they wanted to know what Medicaid, behavioral health, and DDA had done in response to the COVID. Our boss, Secretary Neal, presented initially, and then Medicaid, behavioral health went, and then I went last. And so we know that some of the information that I presented, and maybe some of you were on that webinar. If you weren't, I'd just like to recap quickly what I talked about, and basically said that we've been conducting weekly webinars for individuals, families, direct support staff, and for providers. And that we had been joined by Dr. Fetter, who is the epidemiologist from Center for Disease Control, who's assigned for us and who's worked with us and helped create screening tools and checklists for people who are in group homes. And that we have a dedicated web page for COVID-19 with resources and toolkits and all of the guidance that we've talked about on previous webcasts. And so, which includes testing. I also mentioned that we, to date, we meaning DDA, have had the ability to distribute 137,000 pieces of PPE, personal protective equipment, to providers in all 4 regions and families throughout the state, not just the provider community. And that as we move forward, we will continue to look at the sheets that we did at a glance with Appendix K to make sure that they are current. There was an opportunity after I finished my presentation for a direct support professional, a parent, somebody who's in services, and the provider association to do a presentation. They focus basically on looking at reimbursement for PPE, the retainer days, 18 versus 30. We know we've had a lot of discussion about that, the staff shortages, which is why we wanted to take a look at it and work with our providers about doing a survey to see what did you look like before and then during, and what do you think as we open up what you would look like for your staffing in order to meet the needs of the participants in the waiver who have chosen your areas. I do want to say that, I've thought I've been clear all along that we have not said that we would not be providing any reimbursement that the providers have paid for out of pocket for PPE. We basically have said that if you have bought PPE in addition to, well, prior to when we got our first deliveries from MEMA and DDA, that keep your receipts, not just for that, but for if you're buying cleaning supplies, et cetera, in order to keep people healthy and safe. And then we would figure out when DDA did receive any money, how we would distribute that. So I just want to make sure that that's clear, because sometimes it comes across like, well, DDA hasn't done anything for us yet. Yet is because DDA doesn't have any additional funding. But again, my commitment to everyone is that if you have gone out of pocket and we can find money to reimburse, we will do that. So I just want to make sure that's clear to everyone. And again, I want to thank everybody for all of the work that they're doing throughout this pandemic. So my next slide talks about PPE a little bit, and obviously that's come up in previous webinars. We've had one of the nurses from infection control do a presentation the same day that Dr. Fetter was on a few weeks ago. And I do want to say that of the 137,000 pieces of PPE that went out, that we've actually been able to touch 118 people who participate in self-direction and 127 agencies. I can tell you this upcoming Monday and Tuesday, we will be getting additional deliveries to the regional offices. They'll be doing 2 on Monday and 2 on Tuesday, and that the regions will be able to distribute additional PPE to people in self-direction, the microboards, and agencies. So I'm sure that we'll continue to move forward with that, keep people safe, keep social distance, wear masks, etc. The provider survey. We wanted to know, as I mentioned on previous and just a few seconds ago, we want to know what people and agencies are going to look like with reopening. What did you look like? Did you furlough staff? Did you lay staff off? What does that look like? What do you anticipate that you look like, et cetera? We had our consultants from A&M work with us. And I'm just going to ask people to, if we could pick up where we are, because we were going to try and close this out by the 29th. I don't think that's real good, because we've had 55 providers of our 200 providers basically respond. So I'm going to ask the providers who are on this webinar, if you haven't completed it, please complete it, so we can start taking a look at what it looks like when we do managing and reopening, and have that discussion with DDA regional offices and with myself. And so again, I think it's extremely important that we start taking a look at this and, utilizing data to make decisions as we move forward. There's another area that I wanted to mention also, and we in the last 4 years, and you obviously have completed the National Core Indicators Staff Stability Survey. And obviously that's important information so that we know what we look like prior to COVID with turnover, et cetera. And that we will, and obviously all of this information is de-identified. It's not, we say this provider said this, that does not happen. So rest assured that this is all confidential. You actually go directly to the NCI website for that information to participate in that. But again, I think it'd be important, especially in looking at where we are. We're probably going to be in this for quite a few more months. At least, and then hopefully that we have some lessons learned about how we provide supports, what the individuals want to do in the future, the way they're providing for individuals, what individuals are saying that they want through their person-centered plan, etc. And so obviously we're all in this together. We need to collaborate, have some patience, and be able to move forward and have a quote-unquote new normal. I don't think we're going to go back to the way we were with providing some of our services. I think we need to get a little more astute in the way we provide supports and services to folks with assistive technology, with thinking beyond the current definitions that we have in assistive technology, and what does that look like so people can be more independent. Obviously, we've got our toolkits, and I think the good news is on this slide, if you look at the bottom, that it's translated into multiple languages so that people can, who are more comfortable with their native language, would be able to ask questions, receive information, etc. We know in some of the counties that we have like 21 different dialects and languages, etc. So again, I think we know that we need to be sensitive and communicate to individuals so that we are meeting the needs of individuals and families, etc. The updates that I've been doing, obviously for the regions, and this is as of yesterday, the 25th. The South region has 212 confirmed cases, and this is for participants in the waivers. 57 negative, 1 pending, and 14 people passed away. In the East region, there's 29 confirmed positives, 31 negatives, 2 pending, and no one had passed away in the East Shore. Central is 135 confirmed, 213 negative, 4 pending, and 15 individuals have passed away. And in the West region, we have had 20 confirmed, 110 have tested negative, 2 pending, and 2 people have passed away. When we look at our direct support professionals, there are 148 positive in the South region with 4 people who passed away. In the West region, there is 26 positive. In the East region, there is 50 positive. And in the Central region, there is 152 positive and 1 person who passed away. When we look at our tracking, you will see that it stays flat with the 17,764 with the people who are enrolled in our waivers, basically, and we move forward then with 2% or 394 people have tested positive. The chart on the right obviously shows the number, and you can see that we've had an increase in the 3 regions over the past week or so. On our other tracking, we looked at the on the left chart. You'll see between June 5th and the 25th, which is yesterday, we had an increase of 2 people who had passed away of the 394 who have tested positive. And so the total is going from 29 to 31 people who have passed away, which is about 7% of the people who have tested positive. And so, so since June 12th, we did have 3 additional people who passed away in the central region. And again, as we move forward, we'll continue to share information. Again, we will go every other week. We will not be here next Friday. We will, as soon as the PPE is delivered to each regional office, make sure that everybody knows that they can come in and start collecting, or we deliver from out of some of the regions also. So we need to figure out at a local level, what does that look like in order for providers, individuals, families, etc., to have PPE. And so as we continue to move forward, we'll keep you updated. I know I went a little fast, but we have quite a few presenters today. And now I'm going to turn this over to Kathy Marshall to talk about the great meeting that she called me after she had met with the regional folks, providers, and said it was a great meeting. It was great interchange, etc. And I'm not going to say anything else because I don't want to steal her discussion point. So with that, Kathy.
Good afternoon, everyone. Thank you for allowing me to be part of your discussion and your webinar. And Bernie's right, we had a very healthy and wonderful exchange between several providers. Next slide, please. I actually ended up with 7 pages worth of notes that the information was so rich. And it seemed very quickly that we came across several themes. The themes were around reopening strategies. There's no one out there who thinks they're just going to open their doors and we're going to go back exactly the way things have been in the past. Personal protective equipment and the compliance, assistive technology, rethinking the service delivery and home and community-based settings rule, Appendix K, the regional office response, and then some new resources from the call. Next slide, please. As we have talked with providers over the phone, had email exchanges, and talked with our group, our Google meeting last Wednesday, it is very clear that reopening strategies are not cookie cutter or something that you can just fill in the blanks. Providers are very, very sensitive to each individual's needs that they serve and what their families may be experiencing right now, and very agency specific. Despite those challenges, there have been some very creative options talked about. One of the options is, what do schedules look like? Do people come to a site every other day? Do they come in the morning and somebody different comes in the afternoon? Does a group come on site 1 week and spend a week off site doing remote services? What does that look like? Use of space has changed dramatically. Some of our providers have very small on-site service buildings or areas, and so they're looking at creative ways of using the space they have. One provider has turned conference rooms into meeting spaces. Another provider is bringing individuals in one side of the building and the other side of the building and basically doing dual entrances. And it's very clear we're looking at a combination of service delivery. and we will talk about assistive technology a little bit later, but assistive technology has really provided a lot of comfort to individuals and families, and it's a brand new avenue for some of our direct service providers. Providers are also looking at the comfort level of the individual and the families. Some individuals are very frightened to come out of their home environment. Others want to come out of their home environment, and families are very afraid of what they could either give to their loved one or could they share it and then their loved one take it to someone else. Everyone has been slow and has thought out very well what openings will look like. Some of our providers who have already begun to reopen or who have never totally closed are looking at phases, and everyone has flexibility built in. This COVID virus, we all know, is projected to have a second wave. None of us know what that second wave will look like, but every plan that's been shared with the regional office shows that maybe we're at phase 1, then we move to phase 2, we have an outbreak, and then we go back to phase 1, or do we need to close again and go to all remote services? Next slide, please. PPE and the environment. As Bernie already talked about, availability and cost of PPE has been a huge challenge and stumbling block for many of our providers. Mask and compliance with masks, and we heard from several providers that many individuals in service were much more compliant with the use of their masks than the staff are, and they have to remind the staff about the appropriate use of PPE. Also, with the advent of personalized masks, many providers have found if an individual can select a mask with their favorite character or color or sports team, that they are much more compliant with its use. And for those individuals that masks are not working, either because they don't like the feel of it or they feel like they can't breathe, some providers are using face shields and finding out that face shields are an answer for those individuals. The sanitation of space, vehicles, any surfaces, the biggest come away with that is how absolutely labor intense that is. We might be used to cleaning up an area every day at the end of the day or every other day. Now you're talking about cleaning before people come in, after people come in, and between individuals, and that has been a huge labor intense activity that the providers have discovered already. Next slide, please. Assistive technology has really begun to bridge the gap for many individuals. We've all heard a lot about Zoom, but the individual stories that go with Zoom. One of our providers talked about, we might be talking about a Zoom exercise class, but then it turns into support for an individual first thing in the day as their day starts, so they're not worrying about everything during the day, or maybe it's at the end of the day with another activity. There are other platforms out there besides Zoom. Several providers are using Google for nonprofits, which also has a Google Classroom, which has some very interesting and inventive things in it. There's another one called Open Future. And what Open Future does is the individual and the staff person assisting them are doing side-by-side learning. And this has been something that the direct support professionals seem to really, really enjoy. No one is talking about eliminating assistive technology whenever we start back into a time where we don't have to wear masks. But moving forward, everyone is discussing how do we balance assistive technology with other service delivery options, particularly for individuals who have many health needs. And can we look at this as a staff retention tool, because our younger direct support professionals are very tech tech savvy and find this as a very rewarding way to assist the individuals they're working with. Next slide, please. And then I just listed some other themes. Everyone is talking about rethinking service delivery and how do we use buildings and if we use buildings at all. One of our providers said, when we had to close everything and then think about reopening, it was like taking a deep breath, stepping back and saying, where are we going? What are we doing? And what do people really want out of their lives? Appendix K, many providers have said was a real help to them, that there were services in Appendix K that they had not even thought about meeting. And the way it has been streamlined, services can begin immediately or upon identification that there is a need. And other providers have told us that DDA being able to provide PPE to them either bridged their gap or assisted them to get to their next delivery of PPE. Thank you.
Good afternoon, everyone. The Southern Maryland Regional Office Provider Work Group met earlier in the week and I would like to share with you some of the information that we discussed. The work group discussed reopening considerations pertaining to safety, collaboration, data, capacity, and innovation. Safety considerations were focused around what are the orders of the governor to mitigate the spread of COVID-19? What are the local jurisdiction orders that are in place to control the spread of the virus? And what is the individual health and safety needs of the people that are being supported and how it will factor into decision-making? And we also discussed whether agencies have sufficient PPE to slow the spread of the virus, and if not, how will agencies obtain necessary PPE to safely move forward, considering the possibility of a resurgence? As a person-driven system, the DDA encourages collaboration amongst agencies, individuals, their families, and CCSs to discuss what moving forward looks like for each individual person. Some collaboration considerations were centered around how will people and families be involved in decision-making, and how will providers collaborate with individual teams to determine the health and safety needs of each person they support, keeping in mind Dr. Sutter's recommendations and local jurisdiction orders. Next slide, please. In this public health emergency, data has been the driver for most local jurisdictions. As agencies begin to look at developing their plans, it will be important to have the right data to make informed decisions. Some considerations pertaining to data are: what data do we have and need as an agency? How will data be utilized to guide the process? And what MDH and DDA data would be helpful in the development of plans? As agency begins to look at establishing a plan to move forward, it will be important to look at capacity also, as it relates to health and safety considerations, but also to workforce capacity, financial capacity, and technology. Some considerations pertaining to capacity are: what is your agency's workforce capacity, and what is your capacity to respond to a resurgence? As we all look for a path forward, innovation is also going to be a key to ensure we can meet the challenges of the day and provide the health and safety supports people need to live a good life in their communities and with their families. Some considerations around innovation are: how can we rely on community resources? How can we increase our use of technology to support families? participants, and agencies. Next slide. Some key points from our discussion were that all providers are at different phases in the development of their transition plans and maintaining the health and safety of the people they serve and their staff as well. And that is at the forefront of all of the decisions that they are making. Some are seeking information and ideas to establish a plan that is taken into account all necessary factors pertaining to individual, provider, and system considerations. Specifically, providers are collecting data, conducting assessments, and actively communicating with families to develop the most comprehensive plan possible. Some providers already have a plan in place and are very open to sharing their methods and strategies that resulted in the development of their plans. Some plans are focused around a gradual approach to reopening, and some have a strong emphasis on the implementation of virtual supports. And in some cases, there's a hybrid of these two approaches. Next slide. Some other key points are that providers are engaged in a very deliberate and thoughtful planning process, and some are enlisting the help of subject matter experts. They are also engaging in various work groups, reviewing reopening frameworks from other states, and collecting data to make informed decisions. And finally, some providers express a need for additional state and local resources around PPE, technology, and ongoing support from the DDA. Next slide. Regarding next steps, I am currently in the process of incorporating the feedback that was received. I am also planning to share key information and frameworks via a Google Drive, and we are planning to meet within the next few weeks to continue our discussion. Thank you, and at this time, I'm turning it over to Shara Davidson-Russ from MARS.
And again, my name is Shara Davidson-Russ. I'm the program manager here at MARS. If you can go to the first slide, please. So for a little over 3 months now, a lot of what we knew as normal drastically changed due to the COVID-19 pandemic. So we're now in what is considered to be, as Dr. Smalls has mentioned many a times, and Bernie, the new normal. Arriving to this new normal forced us all to kind of look at ways we operate in all aspects of life. So in the best interest of not only ourselves, but also of the families we serve, we have all had to come together to arise to these many challenges. Next slide, please. So keeping that in mind, we begin to look at best practices as a collaborative unit and how we can utilize and adhere to those practices to best support our families in light of this pandemic. So that meant collaborating with the Maryland Department of Health, DDA, the Center for Disease Control, and then just following other state-related entities and guidance so that we can best protect and support the people that we serve. Next slide, please. One of the first things we did following guidance was to practice social distancing. So that meant that all home and community-based visits were suspended in an effort to prevent the spread of the virus. But then that also meant increasing communication. So we also began tracking COVID-related cases for people who were exposed, people who may have been suspected to have the virus based on symptoms of their reports, and then of course those who tested positive. And this allowed us the opportunity to provide additional resources for these families, provide them with testing site information for others in their circle that may be affected as well, and then just to provide overall support. But because things in our world seem to have changed overnight, it required all hands on deck. And that meant having open communication, collaboration, and teamwork within the agency, with the families, with other CCS agencies, providers, and the DDA. And this did prove to be very valuable and vital in the process. So in response to COVID-19, that meant all departments were needed to help ensure successful implementation of these new policies and procedures. So this included such things as holding virtual meetings, teleconferencing, verbal consents, and then weekly wellness checks. So for example, some of the families were uncomfortable conducting virtual meetings and giving verbal consent. Therefore, we worked with IT to kind of enlist their help so they were able to enable an audio conferencing service that was offered by Microsoft. And that acted as a safeguard for ensuring HIPAA compliance and then to ease the mind of some of our families. And they expressed great gratitude for ensuring that we kept their information private, but that we were also still able to assist them in getting the services needed. Next slide, please. So in keeping up with best practices and to then compensate for the lack of in-home visits, that meant the coordinators needed to increase contact with their families by conducting weekly wellness checks. And those weekly wellness checks allowed the coordinator to have more frequent and detailed conversations with the families, with team members, and providers to be certain that if the person's overall needs are being met in light of this pandemic. Next slide, please. So there was a concern with how we would contact so many people each week in conjunction with making sure we were meeting all other CCS role requirements. So in response to that concern, we wanted to ensure that the coordinators contacted everyone on their caseload, and that meant every single person at the start of the pandemic, to provide whatever support and resources were needed. They were provided with tracking sheets so that they could begin making and documenting their calls and tracking those calls. And then they would then turn that sheet in at the end of the week to their supervisor and myself as the program manager, so we can use and analyze the data, report any important information to DDA that needed to be reported, provide additional training, follow-up, and resources if necessary. The QE team also pulled a list of the consumers who were at the highest risk of negative outcomes associated with COVID-19, and that was based on recommendations provided by Health Risk Screening Incorporated. So although the aim was to contact everyone each week, if a CCS had other obligations that took precedence over making those wellness calls, it was really important, and those things that would be more important were, of course, developing those plans and getting those waiver documents in to assist them with getting their services as quickly as possible. Then we would make sure that the coordinator scheduled another time during the week to still ensure that they are contacting those people every single week. So those are the most vulnerable populations. And so at some point with those wellness calls, 1 week you may have contacted, we maybe have been able to contact 50% of the clients, but that next week we want to make sure we get the other 50%, so that within 2 weeks we are still contacting every consumer. Next slide, please. This is a little small, but it's just an example. So we gave out a wellness guide, and it helped CCSs kind of start the conversation with families to identify what impact the pandemic may have had on them, and then how we can best support them. And by identifying these things and collaborating with our community providers, we were able to share the provider updates, give resources that are COVID and non-COVID related, as well as share important information from DDA like Appendix K and some of the family support series and webinars. So in closing, we've had a lot of staff and people that we serve that were affected by this pandemic, and we knew that for our coordinators who also successfully help these families, they too must have the support and resources needed to do so. So what we do is try to make sure we also check in with them regularly, offer and share resources that are vital to them, because they can't show up to help the people we serve if they're also not taking care of themselves. So we all just got together to get things moving for the overall good of the agencies and, of course, the families we love to serve. So that is just some of the ways that MARS has stepped in to try to assist and support the families. Thank you.
Good afternoon, everyone. My name is Alan Sheehan. I am the Programs Director at Service Coordination. On the line, we also have Mark Weinstein, Regional Director of our CCS services. I'll be passing it over to Mark in a minute. Thank you all for allowing us this opportunity to present on what we've done during the COVID pandemic. You'll see a lot of similarities in what we share. One with those that MARS shared. We have done, I think as an organization and as a service in terms of CCS services, there has been an immense amount of collaboration. And we've heard that mentioned throughout this presentation in the past. And I do want to express my appreciation across the board of how much everyone has come together to work through challenges, really get creative, and to develop some really solid solutions. We held a best practices meeting back in April with CCS organizations, and there was a lot of great sharing of resources and practices and experience that were shared during that meeting that you've heard today and that you'll hear a little bit more of from Mark. But it really has been a pleasure to work with everyone. Getting some background. It really has been a pleasure to work with everyone.
Mark,
Hey, Mark, can you mute yourself for a second?
Thanks.
Okay. And we really appreciate everybody's collaboration. We have also done a lot of collaboration with providers, direct care providers, and I would encourage anyone experiencing challenges, whether they be obstacles to providing services or health needs for people you support, please reach out to your CCS so we can assist. That's our role. That's what we're here for. And we want to assist in any way, shape, or form we can to ensure they're getting the services that they need. With that, I will turn it over to Mark Weinstein, who is our regional director. Mark?
Okay, thank you, everyone. Yep, thank you. Good afternoon, everyone. At Service Coordination, our approach to COVID-19 mirrors how we provide case management services. We utilized and enhanced our connections, communication, and collaboration to support the health and safety of people that we serve and to support the system to be successful during the pandemic. Next slide, please. Connections. We are conducting weekly wellness checks with people we support. Check-ins have helped to make sure that people have the information and support they need. We're paying attention to HRST scores and risks to support teams to pay attention to those areas. We provided needed resources for food, testing, PPE, etc. And people really expressed their appreciation for the contacts. We also created what we call SCI Connect, which is a weekly email newsletter for stakeholders. It includes COVID-related and non-related news and resources. Next slide, please. Communication. We also created something called SDI Alerts, and that's an internal website with resources for coordinators. It includes provider updates with information on closures and changes to service delivery. It also includes talking points for coordinators for when speaking with people and families. We've been conducting town halls, which are virtual meetings with our team members at Service Coordination. We've increased the frequency of these meetings from monthly to weekly. On the town halls, we share resources, updates, and information provided in an open forum for our team members to also ask questions and to express their thoughts. We found it essential to stay in touch during a very trying time so that team members feel supported and have the information they need to conduct their roles in new and different ways. We also have provided resources and training related to COVID and Appendix K. Next slide, please. Collaboration. The pandemic provides us the opportunity to get to know people in new ways, including speaking with people one-on-one using technology, checking with people on evenings and weekends, and interacting with families in new ways, including supporting attendance at meetings, even if they live in a different state. We've collaborated with our partners in new ways as well. COVID changed the conversation. What does support look like now? We engaged our partners, including providers, other CCS agencies, and DDA. Like Alan mentioned, we hosted an online forum with other CCS providers to share ideas and resources focused on supporting people during the pandemic. We've built on our collaboration, leading to solutions benefiting people. We realized that we are all in this together. And our engagement increased. Internally, our team members report feeling more connected and engaged. We increased our internal communication, including team check-ins, regular updates, and open forums. As we all know, an engaged workforce helps to increase quality service delivery. Next slide, please. So the impact, what's been the result of our efforts? We have a few examples to share. We connected people to online social groups to increase the social connections and reduce feeling lonely. We provided resources for PPE and instructions to make masks out of t-shirts and scarves. We've shared online grocery delivery services so people can get food. This has been especially helpful for people who live alone. In a couple individual examples, we've encouraged a man to improve his personal hygiene and advocated for accommodations at his work to help him stay healthy. With team encouragement, he went to the doctor and received treatment for an infection that he didn't even know he had. That could have been very serious. In another situation, we advocated for personal supports to be provided to a man in his apartment when management originally would not allow the service. The personal supports are critical for his health and safety. We also helped someone secure funding for a tablet to allow her to receive remote supports. Next slide, please. So what have we learned? We are stronger together. Sometimes it takes an event like COVID-19 to help us realize that we must work together in collaborative ways to be successful. It is often the only way we all can make a difference in the world. Communication is key. We are learning that during these times, it might not be possible to over-communicate. We all thrive and we are all connected and have the information needed to make the decisions we need to make. We have an opportunity to think and plan for the future. What will life look like now and moving forward? Events like this can give us a chance to pause and plan. At Service Coordination, we're taking that opportunity. And I'll finish with a quote from the famous football coach, Vince Lombardi, that seems very meaningful in the moment. Individual commitment to a group effort. That is what makes a team work, a company work, a society work, a civilization work. Thank you.
Thank you, Mark and Alan and Sharon, Kathy and Onesta for your presentations. I am now going to move to questions. And so I'm going to start reading them. Rhonda, can you read the first couple of questions, please?
Sure, absolutely. This is a question for Valerie. For our fiscal year 2020 and fiscal year 2021, rates in PCIS2 are the same. Why is this?
That is correct. When we had to move the rates for all the services within PCIS2 earlier in June in order to process the first quarterly payment. At that time, a final decision about any budget changes had not been made and would be made early in July. But we did not want to hold up the Q1 payment, so we kept it level funded.
Great, thank you. There's a question about the survey that was mentioned. Where is the survey? Was it emailed or is it on the DDA website?
The survey was sent to providers and was sent out by DDA's consultants, the Alvarez and Marcel team. I will ask them offline to provide the information.
And
Great.
they would have gone to all the executive directors because those are the email addresses that I gave them.
That's correct. Thank you, Patricia.
Another question, Valerie, that you can help with is, will DDA commit to continuing to fund daytime hours for people in residential who are staying home?
So these hours are associated with the changes that we made relative to Appendix K and that were approved by CMS. As the changes in Appendix Appendix K are in effect until the end of February of 2021. So the additional hours will continue until such time as there is a change.
Thank you, Valerie. Another question is, one provider has allowed individuals to have visits with their families outside of the home, such as in a park, but not in the home or overnight with the family. Is this allowed, or are they supposed to wait till phase 3 begins? Kathy and Onesta, didn't know if maybe this was something you might want to address.
Hi.
Hi, this is Kathy.
Sorry, Kathy, go ahead.
Okay, for each provider, it would be up to that provider and what is going on in their particular counties. For instance, Garrett County has had very, very, very low COVID infection rates, while Montgomery County's has been very high. So that decision is being left up to the providers as they work with their families.
Great, thank you,
Vanessa,
Kat.
would you like to add to that?
Yes, I was just going to direct people to Dr. Fetter's checklist. And I know one part of his recommendation was to limit visitors. Again, but that is only a recommendation. But like Kathy said, it's solely up to the individual provider.
Thank you, Onesta. Valerie, there's a couple of questions that I'm going to time into one, and they're about payment and reimbursement. And some folks are saying that they've spent an enormous amount of funding and money in reference to address some of the COVID-19 concerns. Some folks have spent money on air mattresses, blankets, and things that they needed to purchase to provide staff with quarantine and provider supports in the home. Is there going to be any type of reimbursement or support for providers that have done this?
So at this time, there really is not a funding mechanism to provide reimbursement for those types of items. However, we will continue to look at available funding to see if there are any opportunities. But at this time, DDA does not have the funding to reimburse for those items. But we have heard some concerns about these types of items, PPE, other things. So we are continuing to look at ways that we may be of assistance.
And there's another question in reference to PPE. And this is a Bernie question, mainly in the regions. Are we able to get PPE if we do not have a current outbreak so that we can begin to build up or supply to prepare for a potential future second wave? And also for providers who are going to be opening their programs who may need additional PPE.
So one of the issues that we had in looking at the how to distribute PPE when we first got our first order is that we had some people come in and say, I want 100 boxes of gloves. If we gave 100 boxes of gloves to that one individual, we wouldn't have anything for anyone else. Subsequent to that, the regional directors, have created a form that would triage who would get who would get PPE during this COVID time. Obviously, if people have people who are active, they would go to the top of the list because they have active people, etc. I think it's got to be done on a region by region basis because, again, the numbers that we see throughout the 4 regions are much different. That's a long way to say possibly. I can't guarantee if somebody has a lot of individuals who have either tested positive, needed to be either isolated or quarantined. In my mind, that would be a higher need than somebody who had was fortunate enough not to have anyone who was tested positive, etc. I think that statewide we've done a magnificent job with having about 390 some odd people who have tested positive out of the actually it's the 18,000 in the waiver, but if you add people who are just receiving the case management, it's closer to 24,000. We've concentrated on the 18,000 in the 3 waivers, but again, I think everybody's done an outstanding job.
Thank you, Bernie. This one is for service coordination, either Mark or Alan. So for folks who may not have been able to get the newsletter, how can they go about getting the newsletter? And then can you also share how can they access the social groups?
Sure, absolutely. If there's somebody that you want to add to the newsletter, please reach out to either myself or Mark, and that can be through email, or just feel free to call us to pass on their email address, and we can add them to the list. My email is asheahen@sc-inc.org. Mark Weinstein's email address is MWEINSTEIN with the same email address. And I'm sorry.
We'll make sure we add those emails to the folks who participate in the webinar.
Oh, thank you, Patricia. And those email addresses can be used for social addresses or social connections as well. They are, depending on the person, where they live, there's a lot of different opportunities out there. Please reach out. We'll be happy to provide you with whatever resources we can.
All right, thank you. And Kathy, this could be actually for any of the panelists, but let's see if we can hear from Kathy first, and then I'll address everybody else. What examples of assistive technology devices that have been helpful for individuals during COVID?
Number one have been Kindles. Number two have been iPads.
Thank you. Onesta?
And based on the discussion I had with providers, people mentioned iPad and also laptops, because it allows for certain access and allows them to be able to actually provide better training and to be able to take over in order to assist with training.
Okay. Service coordination or MMARS?
For MMARS, it's been the same thing here with the iPads, laptops, and then the tablets.
Okay. And Valerie, this one's for you. Can you address transportation funding moving forward into FY21? There's no funding that has rolled over into FY21. Will this be added back into individual funding? I'm not sure if this is something in somebody in self-direction or traditional services, so I'm not sure how to frame that one.
Yeah, because it does make a difference. If they could provide more specificity, then we can probably answer it correctly.
Okay. Here's another one. It just says CCS continues to hold PCP meetings even in the absence of important key members of the individual's inner circle. How can there be a comprehensive plan for the individual if key members are not present? Alan, can you address that?
I can. Thanks, Patricia. Yes, that is a huge challenge. We have found there are different limitations or challenges for having different people participate. As always, the people who participate in a person's meeting is up to the person. And during COVID, we have found it more challenging for certain people to join in on different meetings. If there is ever a thought that somebody is being left out who's important to the person, please, please, please make sure you're talking to your CCS. There is the possibility that that person has a challenge. There's the possibility that whose team meeting it's for maybe chose not to have them attend, or it could simply be an oversight. And we hope it's certainly not that. But as Mark said in the PowerPoint, it takes all of us working together. And if there's a team meeting and somebody's important and vital to that team meeting, they should absolutely be included, unless there are challenges that prevent them from participating.
Thank you, Alan. And this is my last question that I'm going to read. Rhonda Workman, can you answer this one? We're starting to hear from some residential providers that they have made a decision to not allow individuals living in their group home to return to their programs or to go out into the community to receive personal supports. This seems like a violation of individual rights. So I'm curious as to DDA stance on this issue.
So that's a great question. And we believe in and encourage the use of person-centered thinking, working with the individual in terms of what their needs are and what their choices are related to services and supports. As Nesta has shared, there is a lot of guidelines that we have shared from the CDC, Dr. Fetter, and considerations related to individuals' choices and rights. So again, we go back to what's the person, what's in the best interest of the person, and their voice and choice needs to be heard.
Thank you, Rhonda. It is now 2 o'clock. Please remember the next Friday we will not be having a webcast, and we hope you join us the following Friday. Stay well and have a wonderful 4th of July weekend.